Friday and they have an order for a narcotic, and the on-call has to approve it. Maybe they only approve like 10 tabs, but so-and-so is taking it every 4
Okay,
hours.
so are
It's
you
not
asking,
enough.
are you asking the doctor for a 2-week supply?
No, it's usually not us. It's usually the pharmacist that's trying to get hold of the doctor and get.
No, but I'm talking about a regular supply, when they first, well, when Dr. Yuha's still there.
Yeah.
Dr. Yuha.
Uh-huh.
If Dr. Yuha's orders something, is he only ordering a 2-week supply, or is he ordering, you know?
No, he'll order if the order's like Q 6 hours. He'll do the math and
And
order.
order a 2-week supply?
I don't know. Sometimes he orders a lot.
Because that's what she's saying,
Sometimes
she
it's a lot.
only wants it, yeah, but it depends on what they're getting.
Yeah, and usually the pharmacist called us, who's the authorization by Dr. Yuhas, and how many do you want me to dispense a medication to send it to you guys? Usually I said, I am one of the authorization of Dr. Yuhas, I only want 14-day supply.
Yeah.
But sometimes it was just like a one-time order, I only want 2 times.
Yeah.
Are you sure? Yes, I said yes.
Yeah, no, she said now that they only wanna get a 2-week supply, so before I put it in stone at the pharmacy, only dispense 2 weeks
Yes,
for them.
ma'am.
I wanna make sure that that's exactly what you're doing. 2 weeks on all narcotics?
Yeah, unless someone's on a routine, like
I mean,
Elsie's on routine
unless
tramadol.
I mean, our long-term people, if they've been on, but I mean, our rehabs, let's just do 2 weeks.
Okay.
And then we'll work on the hospice issue too, because hospice is the other one that,
Oh, gives you a supply that's
well,
gonna
we,
choke on.
sometimes we order and then they order, and then we've got doubles and
Okay,
triples.
now will Dr. Yuhas just give you a 2-week supply, or are you gonna get your 500 tablets from him
For what?
for any of the narcotics?
I mean, hospice?
Oh, no,
Most of them are Dr. Mons, they're not UHASs.
okay.
For rehab. For
For
rehab, yeah.
Okay.
Alright, let me
got
go
it.
get Zoya.
Okay. Here, ladies. Treat.
Thank you. We love the sanitizer treat.
Winner.
You know, I can't get the sanitizer.
I bet you
Yeah,
can.
I know,
They're
that's
so
I know.
expensive.
It is, but we have gallons and gallons there.
They're so expensive, I can't get them anymore. I mean, I always had a supply of them. As a matter of fact, I have a health fair that I have to do, an employees' health fair at the beginning of October, and I thought, I think what I'd like to do is make a kind of a first aid thing for them. So I put in the hot cold packs.
Wow.
Have you had those? Have I ever given you those?
No, we
you
didn't
haven't
get
given
anything
us, but I'm
from Rose.
Don't start on me.
I think my favorite was the pop packet that had candy in it.
Yeah.
Oh, yeah.
My niece
See,
loved
I
Oh,
don't-
my daughter loves
I
it.
don't even do that anymore. I can't
And I
do
love
that
the one
anymore.
with the lunch bag. I still have the lunch
Yeah,
bag.
the lunch bags we don't have anymore. But anyway, these are the ones with the little jelly bubbles inside,
Mm-hmm.
you know, that you can put in the freezer or put them in the microwave. So I put in one of those, and then I put a couple of masks in a plastic bag for each person. And I was hunting all over in the pharmacy, all my secret spots, because I hide stuff in the warehouse, so that, well, because I lose it. And I did find a box of hand sanitizer, but I don't know if I have enough to go, you know, for them or not. So if I have some left over, you know, come on down. I won't bite you.
Please don't.
Okay, I'm gonna move a little over this way, just a little bit, not because I wanna get away from you, but because when I do the in-service thing, I always like to take my mask off, because then you can understand me a little. For those of you that don't know me, my name is Nancy. I am your nurse consultant and have been since, 20 years. 20 years.
20?
I was gonna say, some of you probably are younger or weren't born when Hi, you're coming in now too?
Are we recording this session?
Again?
Yes.
What is this recording of me? No, I don't like this. this is MedPass in service. Generally, what I do with the MedPass in service is I use the actual form that if I'm coming in to do a MedPass on you, this is the form that I would use. And the reason I do it is that it's difficult to do a MedPass in service and try to hit on all things. So the most important things, these are the things that the licensing would be looking for when they're following you on a MedPass. So that's why I use this. You can write on this is yours to keep, okay? All right.
Will you be following us again?
Yeah.
This
I
year?
can't,
Why?
I shouldn't even be this far in the building,
But Miss
Because
Nancy,
of,
you know, we
is
really
it
need
because of
some.
COVID or?
because of COVID, yeah.
Okay.
I should only go as far as like the conference room right by the reception desk, or the conference room that's by the back door there, yeah.
Okay.
I'm not supposed to be on the floor, or, I mean, I can be with you guys, but I can't even come in and do an audit. If I come in to audit your carts, I have to go into a conference room, and you have to
should bring it
you
over.
have to bring the cart to me. So
Mhm.
if you want the carts audited, I can do it that way, but I can't come and do a medroom audit and the same kind of audit that I normally do, okay? So, but I can do that as it gets closer. Right now, we honestly have no idea where, licensing is at. We don't know if they have gone out, we haven't heard anything. They keep sending notices out, we're coming, we're coming. But then they don't tell you when they're coming, or they say, we're coming now, and then you read the whole thing and, well, they haven't been approved to come out yet. So, I don't know how long this is gonna go on. I do know that at the pharmacy, we are prepared, we have plans to carry us through until next year. Like about next June. So we have we're thinking we have another year of this.
Mhm.
Yeah, but we just don't know. And we've got, the thing is what's happening is that, what is it gonna be? Another 6 weeks or so, and we're gonna be in flu season?
Mhm. Yeah.
And what's that gonna do for us? But I'll tell you, I'm not doing my in-service, you can tell that. I hope you're not recording all of these little side stories.
No.
You can delete that one.
No. I'm just typing what I'm the recorder.
Okay,
Sound.
and you're gonna blackmail me afterwards, I know. I had a facility that I was in, a couple of weeks ago. I had to do some auditing for them in their conference room. And, they had several deaths, and I said, well, what did they die of, COVID? And she said, no, the director said no. She said they were hospice patients, they were not at an end stage, but every single one of them just died of loneliness and a broken heart. And she said that every single one of them, they died, most of them died like Sunday night, Monday, 8 of them that died within a 24-hour period.
Wow.
And they had all stated to her, the day before, Saturday, Sunday, whatever, and even on Monday, that they were ready to go home to Jesus.
Mhm.
And, Jesus is waiting for me, and I'm at peace, I wanna go home to Jesus. And when she said, well, why do you wanna go home to Jesus? Because I have nothing. I don't have any family that can come and see me. I can't leave this place. I don't have any of my friends anymore. I have nothing. I'm empty. Inside, I am empty. And that's what killed him.
Yeah.
8 of them within a 24-hour, I hope they do, I think that kind of ended all of their hospice patients for a while. But I mean, it was just, she said it was the saddest thing to listen to them say how they were empty inside. So that's what the COVID is doing in a lot of the facilities.
Yeah.
But you can't bring anyone in.
Yeah. We see it in our patient also, it being on quarantine or isolation for 14 days, and
Are you using Zoom at all?
Yeah.
we using Zoom, yes.
But we do have one patient that it looks like she's gonna stop there. But we did a compassionate visit with her 2 sons, and all of a sudden on the next day, boom, she's okay. She's up on the wheelchair.
Yeah, she has someone to They can't go outside. You couldn't bring them out onto, I'm trying to think of where the patio is, out onto the patio so that they could sit out there with their family.
We
That's
have
what we
family
did.
visit, that's what we did, but we
Yeah.
stopped it because of the outbreak
Yeah.
in our assisted
Yeah.
living and Katzin.
Yeah.
So we stopped doing that. So tomorrow, it will resume the family visit outside. We have the spot.
Yeah.
The shield, and it's sanitizer, tent, and everything. It's a lot of work.
Then you have to clean the tables
Yes,
and
ma'am.
everything
Yeah.
else, right, yeah. Well, okay, all right.
You just,
Can you continue?
The last video was like we couldn't hear it.
Oh,
So
Okay, that's good.
Darn it.
yeah, you guys have to talk louder, man.
Oh.
I need you guys to be yelling.
Okay.
Answer.
Okay, so yesterday didn't come out?
No.
Can we restart this one? Because no.
I oh, yeah.
Laryngitis.
Okay, all right, the first thing, we're gonna go through this whole thing.
Yes, ma'am.
Okay, the first thing is that when licensing comes in, they wanna make sure you're wearing your name badges. If you're not wearing your name badges, that will be part of what they're writing up against you, okay? So if you don't have a name badge, get a piece of paper and, visible.
Visible,
Has to
Sam.
be visible.
And readable.
Readable, yes. So, yes, big letters. I am. So you have it on. If you don't have it with you, if you forgot it, if licensing walks in the door, get a piece of tape that says, "Hello, my name is," and put it on, and that'll suffice. But if it's out in the car, you want to make sure that you go get it. Generally, you can when they come in. You'll notice it, and if something is wrong, with your uniform or whatever, you can kind of correct it before they actually hunt you down. Medication cart is prepared for pass. All items are dated. Sharps container is at a safe disposal line. Can't be full so that, someone could reach in and pull something out. Not that you would want to, but, it could happen. And make sure that everything is dated and covered.
I need a sheet.
Oh. You want a pen too?
No, thank you.
You sure? It's a Ron's Pharmacy.
It's
pen.
Ron's sorry.
Take his.
I'll take
always
it.
need friends.
There's an extra.
Oh, thank you.
Okay. If I have them, I give them out. I'm running low on those too. I always used to come in with a whole bunch of stuff. Now I have.
Yeah, I want Post-it notes and
Yeah.
mouse pads.
The little tiny with the sticky notes, with that stapler, and everything.
Take any of that.
Yeah, well, maybe Christmas might come early. I don't know.
Oh, Santa,
I
please.
haven't been able to order anything. That's just it. I have not been able to order. So I keep hoarding, like I said with those hand sanitizers. I don't think I'm going to have enough because I need 100 for the bags.
Don't worry,
for
Miss
the
Nancy.
employees.
When you get out, I'll text you. Don't forget our hand sanitizer.
Well, yeah. If I have some, I'll get you some.
Dad's reels.
Yeah.
Yes. Yes. Right now, it's pens, and when these are gone,
They're
that's
gone.
it. Yep. Okay, medication cart is organized. Keys and carts are secured during pass. Cart is kept visible or locked. Some licensed personnel will let you pull the cart up to the door and leave it unlocked. And then others will say, well, okay, didn't you go into the bathroom at one time? It wasn't visible, was it? So, you know, they're gonna, and when they first come back, I have a feeling that they're gonna be all over you.
Yeah.
You know, because they haven't been out here in a long time and they're just going to, and at the end, we'll go over some of the things that they have been looking at, okay? Your MAR or EMAR is covered or out of visible contact. What you have to do is when you know, make sure that you have your home screen on when you walk away from the med cart so that no one can look at it and it's not, there's no HIPAA violations. Hands are washed or sanitizer following significant contact with resident and every few rooms. Okay, right now what we are advising is every time you go into a room, you come out and you wash your hands again. And if you go to the med cart and get something else, when you go back into the room, when you come out, you wash your hands again. So it's just wash your hands, whether it's wash or it's hand sanitizer, you need to use the hand sanitizer in 15-second rubs. Don't just, you know, then back in there. You have to really rub it. And, you know, you have to read the medication order. That would be check 1. Then compare and punch the card. That's 2. And then you have to check the MAR to check, that would be your check 3, okay? And then when you punch the medication, then you conduct a check of all 3 of those things on the MAR prior to administration. Make sure that you're checking everything. I know that in some cases now, some of the medication that's coming through is not necessarily from us. They're coming in from other pharmacies too, even in here, well, when I say here, not necessarily here, but even in skilled, they're coming in from other pharmacies. And, you know, it's one of those things at this point. Nurse punches the medication and then conducted the checks again. Okay, sorry, I'm reading the same thing again. Oral suspensions are checked for expiration. You mix, you make sure that you're shaken properly and measure at eye level. Medications are prepared appropriately as needed, crushed, reconstituted, mixed, etc. Remember, when you crush, you can crush everything together. You have to make sure they have a crush order, obviously, but you can crush everything together and then give it to them in one bite if they'll take it.
Except the G.
Yeah, right. We'll get to the G-tube.
We're about to jump into that
G-tube,
topic.
No, one of the things I always recommend is that if you have a patient that is has a tendency to not want to take their meds, and you never know, it's kind of a hit or miss. I always recommend taking the medications that are most needed for them, the ones that they need, and if they don't take them, they could possibly have a problem. Their DIG, their antibiotics, their insulin products, so that you would crush any of that first. The insulin I know is in a vial, I know that. You'd crush it and give them, that would be the first spoonful. And then take anything that's non-essential, like your vitamin C, your calcium, anything like that, you could give to them secondly, so that at least you know you got the essential medications in first, and then put the other ones in afterwards. But that doesn't, I mean, not all residents refuse to take their meds, but if you know you have a problem like that, instead of putting everything together and then having to throw it out and they don't get anything, you know, that's another problem. You should knock on your door and announce yourself before entering. Always make sure that if you go in, again, you come back to the cart, you have to pick something else up, and you go back again, knock again. That's what they're looking at. Did you knock before entering? Yeah, I went back and forth 6 times. Okay, residence is properly identified before administration, picture, ID, armband, whatever. They're looking for 2 forms of identification. So that if you have a picture on your screen, that would be one. When you go into the room, if they have an armband, which a lot of them don't, that would be second. If they have a picture of, some facilities
They have a,
have a badge
badge.
for some of them. And if not, ask them their name, and as long as they know their first and last name, you're fine. You know, that would be your 2 forms of ID. Residents are properly positioned before medication is administered. Make sure that they're, you know, sitting up and whatever, so that they're not gonna choke. Vital signs, apical pulse, blood pressure, BG were taken, if applicable, prior to the medication administration. I know that we all have used our CNAs to take their blood pressure. When they first come in, they make the rounds, and then they hand you the list. You can't do that. Anything that is a true parameter, if it just says take blood pressure daily, don't worry about that. The CNAs can do that. If you have something that says, if the blood pressure is greater than, or if the blood pressure is less than, hold or give, you have to take that
Yeah.
just prior to giving the medication. And you'll be written up if you don't. Because if the CNA takes it at 7 o'clock and it's 9 o'clock, 2 hours have gone by, something could have happened
Yeah.
in that time. So that's the one thing that you have to watch out for. Nurses informs the resident of medications they were given and watch them consume it. Make sure that you can go in there and say, when you walk in, okay, I'm here, I'm going to give you your medication, I have your Lasix, your da-da-da-da-da. If they're not interested, you don't have to give them the full list, you can give them a couple of things, but some of them need to know everything that they're getting, and why am I taking that, you know, so just be aware. But make sure that, you know, if licensing isn't with you, you don't have to do that. Okay, medications given via proper techniques. Eye medication, hand washing pre and post. You have to wash your hands before you put the eye drops in, after they've been given, and you should wear gloves. So you'd wash your hands, put your gloves on, take your gloves off, and wash your hands again. Each drop administered 3 minutes apart, okay? So you have to wait 3 minutes between drops. This says 5 minutes, usually some doctors will tell you 5 minutes or 10 minutes. If the doctor says wait 5 minutes, 10 minutes between different medications, then you wait whatever the doctor says. Otherwise, licensing says 3 minutes. So you give 3 minutes between drops and 3 minutes between an additional medication. So everything would be 3 minutes, okay? Know the proper sequence. Artificial tears aren't always last. Now, I always thought that artificial tears were first,
yes, to cleanse the eye.
to clean the
That's what
eye.
I thought.
But it isn't, they go last. Because then, but you're waiting 3 minutes, so it's not like it's flushing it out. It's just that if there should be a film on the eye or something like that, that would help clean it, or to soothe the eye if any of the medication would burn the eye.
Yeah, you told me that one when you followed me before.
Yeah,
And
I figured
asked
it would
you
go first.
what is the difference between Restasis and regular eye drops, and you told me it's the same. And I asked you if it's that one is the first one or the last one. You told me it's the last one. I said, why? I remember that.
Okay, use separate tissues for each eye and each med, so that you do not contaminate the medication. Do not touch the applicator to the eyelash or to the eye itself. Okay, when you give the eye drops, all right, pull down the lower lid, drop it right in the center of the lower cannula, let it go, and put your finger on the tear duct. That way it won't go into the tear duct to cause an infection or a blockage of the tear duct, all right? If you have patients who have problems, you know, you go up to them, okay, go ahead, I dare you. I dare you, go ahead, put it in. What you do is you take your forefinger and you put it in the center of your eyebrow and you push it up ever so slightly. We're not trying to push the eyebrow into the hairline, we're just trying to push it up ever so slightly and pull down, and you cannot close your eye. Okay, so you'll be able to get the eye drop in there a lot better. Now, anyone that wears glasses has at least one time in their life had ointment put in their eyes. And when you put the ointment in your eyes, it usually makes everything blurry for about an hour. I like to recommend, and you know, I mean, sometimes it can't be done, but not everyone is usually on eye drops, so sometimes you can work it out. If your CNAs would tell you they're going to be getting Mrs. Jones up, you know, in 2 or 3 minutes, you could go in there and put the ointment in. By the time they get her up and they get her dressed and she gets down to breakfast, most of that has dissipated and she's able to see clearly. So it makes life just a little bit more convenient for her and a little more enjoyable. Same thing at nighttime. If you know that someone enjoys watching TV or reading, you don't want to go in there at 8 o'clock at night and put this in, because then they can't read anymore and they can't see anymore. So if, as the CNA is putting them into bed, you can go in and they just get into bed and you put it in, they close their eyes, they go to sleep, it doesn't make any difference, you know, and actually it gets in there a lot better than them trying to rub it out. When you give them a tissue, if you give them a tissue, if they go like this, you know, and they, my eye makeup's all gonna smear all over my face, and they do that, they're going to take all of the medication out of their eye, the drop or whatever, if they're rubbing too hard. So what you need to do, if they're gonna do that, then you just go in and just tap slightly with the tissues, and use one for the right eye and one for the left eye.
What about those people that are like, oh, just stick them all in there?
No, you gotta wait, sorry. And well, just tell them that it has to get in there, and if you put too many in there.
Yeah, we do have that one resident, and I keep explaining, I have to wait. No, at home, I do it like at the center. I said, no, here we have the protocol to wait.
Well, the thing is if we put them all in at once, it doesn't work right.
Yes,
because
ma'am.
they mix together, or they run out, and then you're not getting the benefit of this. Sometimes that works. Inhalers. Bronchial dilators go first. Steroids are last. Shake well before each puff administration. Wait 1 minute between puffs and 1 minute between different medications. This says you can do it up to 5. That's if the doctor asks that long. But state says it's 1 minute, 1 minute, 1 minute.
It's fine.
Inhaler is properly positioned and resident is instructed on proper use. Spacers should be cleaned daily if used. Mouth rinsed with water following the inhaled steroids. When you give someone to rinse and spit, make sure that you tell them, and we've talked about this before, when you tell them to rinse and spit, if they rinse and swallow, they're non-compliant. If you don't say anything, you just hand it to them, then you haven't done your patient teaching, and you will be written, they'll write you up on that, okay? That you did not do your patient teaching. So make sure that you tell them, rinse and spit. If they rinse and swallow, well, so be it. By the time it gets to where it goes, it's gone through all those stomach acids anyway, so it won't make much of a difference. Oh, I'm on, I keep forgetting I'm on that thing.
It's for our personal use. For Seacrest use.
Yeah. Oh, yeah, licensing's gonna get that, and they're gonna, who is that? Don't send that quack in here again. Injections, sites are properly rotated, gloves are used, correctly performed, no shaking of insulin. You roll them only. Mixed insulin, short acting first, then long acting. Rubbing heparin injections, no rubbing of heparin injections. Syringes are not recapped, safety locked and disposed of, okay? Make sure that you, and then remove your gloves and wash your hands. Transdermal patches, existing patch must be removed. The site is properly rotated. Placements are checked. Respirations are monitored if on a fentanyl patch, and as of yesterday, you did not have any fentanyl patches. Co-signatures for patch destructions, and you destroy the patches where?
In the bin, incinerator.
Incinerator.
Years ago, it's been a long time, Southeast San Diego, I was doing some type of auditing, and I was at the nursing station. And this facility had a lot of street people, okay? I mean, it was way down there. And so a lot of them were alcoholics, were drug users and everything. So I noticed that there was this one guy, I had no idea how old he was, and he was kind of, the nurse would come out of the room, and then he would go in. And then he'd kind of look to see where she was, and he'd go into the next room. And so I called the DON over and I said, what is he doing? She said, I'm not sure. So she watched him, and she said, I think he's taking the patches out of the trash. So they called the police, and sure enough, he had this whole big bag of narcotic patches that he was taking.
That's
Because
gross.
at that, well, wait a minute, the story gets worse. So the thing is he was going around to each room picking these up out of the trash. This is before we started, okay, and they found this was one of the places they found in San Diego, but evidently they were doing it. They were finding this all through the United States, but no one was really saying, hey, people are picking these things out of the trash. And what he was doing, because they asked him what he did with these things, and there's two things. They put them in the freezer, okay, and freeze them. They would freeze them, and then if they would go in and they take them out, and they lick them like a lollipop or like okay, they had been on someone's body for 24 hours yet, and we licked them. And then the other thing they would do is they boil them down and then shoot them up.
Some of them, they have scabies on their skin.
Yeah. So anyway, the thing is that, this is something that this is why did I make you ill? This is why we fold them up now and sign them out. But yeah, that was really a big scandal.
It's the fentanyl patch, huh?
Well,
Yeah.
there was other narcotic patches too, but that was one of them. So yeah. But I'll never forget sitting there watching this guy, and I said, "What is he doing?" And the DON she couldn't believe. She said, "I think he's taking the patches." So they called the police, and yep, that was it. Okay, G-tubes. Okay, you have to check for placement with what?
Stethoscope and air.
Air. How many?
10 cc.
10.
10.
30?
It's supposed to be 30.
13.
But the thing is that I always say, if you push it and it pops right away, don't push the rest of the air, because they don't need all of that air in their stomachs. But the protocol is 30, okay? Check for residual, and then always put it back in, please. I still, in recent years, I have still seen nurses putting it in the sink or the waste paper basket or whatever. Don't let licensing see you do that, please, and don't do it. I wasn't insinuating that it should be done, okay?
Okay. That's a good.
No, I'm talking into
Yes,
it.
that's.
And, then flush flush before and after medication. Multiple medications are to be crushed and given separately, so that it would be, each one is, again, we're back to where you said that each medication is given separately, okay?
But they wanted to
A
be
lot of
labeled
fluid.
also.
Yeah.
Big lawyer.
Labeled.
Oh, yeah. And then 15 in between, 30 in the beginning, 30
Yeah,
at the end.
30 at the end, unless specified differently by the physician. Sometimes they'll say, you know, they want 100, 200, whatever, okay? All medications given should be documented on the MAR as they are passed, including controlled drugs. You don't wait until the end of the pass before you do your documentation. You do it after each patient, and when you do narcotics, you take it out, you punch it out, you sign it out, and you put it away, and then you give it to the patient, okay? Refused or held doses are circled. You can't circle on an EMAR, but, you know,
We can mark it.
you can mark it down. The doctors do not understand what refused means. They have no idea. They know that the patient didn't take the medication, but they don't know why the patient didn't take the medication. So what you have to do is to explain explicitly why they didn't take it. It gives them a headache, it gives them a stomach ache, makes them nauseous, it's too difficult to swallow, they don't like you today, whatever the reason is, and then you have to report it. If the medication is, again, something that is vital to their well-being, you have to notify the doctor right away. If it's something that is vitamin C, calcium, you can wait a couple of days to see if they're going to take it at another time. But if they're missing, if they refuse to take their insulin, you would want to notify the doctor right away so that, you know, he'll say, okay, watch for these signs or whatever, so that you do have a protocol available.
Miss Nancy, I have a question. What if my resident is agitated? She refused her medication. Do we need to destroy the first medication and
No.
pop a new one, or we should save it and offer another
3 times.
3 times? Okay.
And if they're agitated with you specifically, it could be, as I say, today the resident just doesn't particularly like you, but she may like a man,
Oh yeah, sometimes.
you know, so you could get
We
one
have
of the
that
guys,
resident.
you could get Albert or something to go in and give the medication. Because sometimes that happens, especially in dementia units. I mean, you are with the patient Monday through Friday, then there's a new person that comes in on Saturday and Sunday. They don't know that person, they forget who it is, they don't trust that person, they don't like that person, and they just refuse to take medication. But if you came in, they'd take it from you. Or sometimes it's just a matter of having someone else do it. So if you do it twice, have someone else try to do it the third time. After the third time, then,
Okay.
by then it's almost time for the next, you know, round of medications anyway. PRN medications are completely documented on the front and the back, which would be not you necessarily. And you have to monitor the effectiveness. Your EMAR system will let you carry over to the next shift. Some of the EMARs don't do that. So you have to have a result put in there. You can't just leave it blank. So if but your EMAR covers it, so I'm not telling you differently, but if you run across an EMAR that doesn't let you carry it over, you would have to go in and say that there were no results this shift. No results is a results, okay? Doesn't sound right, but. All medications are accounted for. Nurse verbalizes proper procedures for missing, we've got typos here, missing meds during the pass, okay? And that would be your med pass.
Yes. Bravo.
I get no respect.
We appreciate you.
Anything,
Thank you,
did you get a
Miss
pen yesterday? I'm not giving you one tonight either.
Not now.
Thank you, Nancy.
Anything else that you need to know, like to know? Wanna yell at me about?
Pharmacy, right?
Any problems with pharmacy?
So far, we're okay with the pharmacy. They're not sending us on the vial. It's on the bubble pack.
How's your cycle?
I'm missing the same people every month, and I call them and I tell them, and they say, "Okay, I'll put it on cycle."
Yeah,
and I'm still missing
and
them.
even the discontinued medication, they're still sending it, and I keep calling them. Now I have a bunch of medication. I just call them. This is discontinued. I send the paper, but this
Okay.
is the second time.
Send it to me?
Yeah.
Okay. Now I have a problem. You can't text me anything this week because the touchpad on my cell phone doesn't work and they've ordered me a new phone, all right? I'm sorry I didn't just go over to Verizon and get a new phone because I think it's probably gonna take a week. This happened Friday, I still don't have my
Why don't you give
phone.
us your personal phone?
Huh?
Why don't you give us your personal phone?
Well, you know why? Because I don't, no, I do that quite often, I really do. But the problem is that I don't like carrying it with me,
Yeah.
so you could try to get hold of me and you couldn't. But I gave everyone my cards yesterday, I'll give you my cards again today, so that you can, if my phone was working, but you can always email me.
Okay.
Yeah. Sometimes I order stuff, I'll fax it, and it's still not here. I give it another day,
No,
and
the
then I
thing-
call, and they said it was never ordered, or it
Yeah,
still
no,
doesn't
that's,
come.
no, because the thing is if it isn't ordered, if they tell you,
It's okay, Miss Nancy, I have your number.
Okay. If they tell you that, it hasn't been ordered and you tell me that, I usually go and find out why they didn't receive your order. I don't accept that from them. You know that.
Yeah, yeah.
Sometimes I fax, and then I call, and then I call again.
Yeah. No, so are you getting a lot of, and I wanna know all the things that the people that you're not getting, that should be on cycle? And, if you have too many meds for something, like we've been sending, and you've got like 4 months worth of the same thing, let me know that. And what I'll do is I'll put a hold on that medication for 3 months or whatever it is, so that, because I don't like to see the resident have to pay for that. So, I mean, most of their insurances will pay the most of it, but there still is a residual.
He's coming today.
Your cycle's coming today?
No,
No,
the
this
other
guy.
resident.
Oh.
I should be coming soon.
But you know what, Miss
They're either
Nancy?
always missing stuff, or they're all missing, or I have to order it separately.